Hey guys, today we are going to study about stroke, which is also known as cerebrovascular accident or brain attack. It occurs when blood flow to a part of the brain is suddenly stopped due to any blockage or rupture in the blood vessels, which leads to lack of oxygen in brain cells, and those brain cells gets die. Death of a part of the brain may lead to loss of certain function controlled by that affected part, and it lasts longer than 24 hours. Other stroke results from causing such as illicit drug use, coagulopathies, migraine, and spontaneous dissection of the carotid and vertebral arteries. The result is an interruption in the blood supply to the brain, causing temporary and permanent loss of the movement, thought, memory, speech, or sensation. In a concise form, we can see that brain does not get sufficient oxygen due to any blockage or rupture in the blood vessels, which may lead to lack of oxygen in brain cells, which causes death of a portion of a brain due to any interruption of blood flow that results to neurological deficit or loss of brain function. Next, we will see what are the risk factors of CVA. The first one is advanced aged, more than 55 years of age, because in advanced aged people have high blood pressure, diabetes, overweight, obese. The second one is gender. In most of the cases, it is found that male have more CVA cases than female due to stress or smoking, alcohol, or any bad lifestyle. The third one is race. Mostly Africans and Americans have CVA cases. The fourth one is oral contraceptive pills. And the last one is elevation of cholesterol level, because high cholesterol level can cause blockage in the arteries and can cause interruption in the blood flow as well as oxygen flow, and the brain will not get sufficient oxygen, which leads to stroke. Next, we will see what is modifiable risk factors. The first one is hypertension. The second one is hyperlipidemia. The third one is arterial fibrillation. And the fourth one is diabetes. The fifth one is smoking. The sixth one is obesity. The modifiable risk factors are those risk factors which we can modify by our healthy lifestyle. Next, we will see what are the clinical manifestation or sign and symptoms of CVA. The first one is numbness or paralysis on the face, upper extremities and lower extremities, most likely on just one side of the body. The second one is trouble in speaking. The third one is weakness of face, upper extremities or lower extremities, especially one side of the body. The fourth one is loss of balance or difficulty in walking. And the fifth one is memory impairment due to neurological deficit. The last one is dizziness. Apart from that symptoms, the other symptoms are also there. The first one is headache. The second one is vertigo. The third one is paresthesia. The fourth one is seizure. And the fifth one is improper sexual abnormalities. The sixth one is nose bleeding. And the seventh one is disorientation of time, place, person. So next we will see the management of CVA. The first management is nursing management, in which the first function of any nurse is to provide emotional support, that is psychological support, to encourage the patient to build up their willpower. Second one is assist the patient to maintain his good alignment, to reduce the pressure points. The next nursing management is to change the patient's position frequently after 15 to 30 minutes. And also check the patient's skin for any peeling, turgor, skin color, redness, pressure points, etc. Provide full range of motion 4 to 5 times a day to maintain joints mobility. And also start an active rehabilitation program when conscious patient return. The nurses should also encourage the patient to maintain his or her personal hygiene to reduce the chances of infection, and also consult with the speech therapist to evaluate gag reflex and assist in swallowing technique and improve his speech. The nurses should also encourage the patient to perform self-care activities to promote sense of control and independence, provide skin soothing care, and also stop the use of soap which will make the patient's skin more dry. For patient, use of stool softener laxative to avoid constipation and also for healthy bowel pattern. Next we will see what are the family goals for the paralyzed patient, because family plays very important role in the treatment of paralyzed patient. The first goal is to improve the mobility and assist in range of motion, and the second one is to provide emotional and psychological support to reduce the chances of depression and stress. The third one is maintain skin hygiene, provide skin care or back care every 2 hourly, change the position every 2 hourly and assess the skin in each 2 hours. The fourth one is maintain nutritional balance, provide good and healthy foods to the patient. The fifth one is maintain health hygiene, provide emollient and antiseptic lotions to the patient. The last family goal is to achieve a form of communication, maintain good communication with your family members, spend lots of time, make them happy, and that will improve their willpower. If you like the video, please hit the like button, do subscribe and share with your friends.